Welcome to another KNTV broadcast. Today's Social Security on KNTV will focus on disability. So we welcome your calls about disability or any questions about Social Security. So you can reach us at 312-738-1060. But before we begin, let's talk a little bit about celebrating a milestone. August 1st of this year marked the 60th anniversary of Social Security's Disability Insurance Program, signed into law by President Dwight D. Eisenhower in 1956. Originally, the program was limited to individuals who were age 50 or older. It also had a 6-month waiting period, and there were no benefits payable to spouses or children. The disability program has undergone many changes to become the program it is today. Now people who receive Social Security disability can also receive Medicare coverage after 24 months, and their dependents may be eligible to receive benefits on their earnings record. There are also work incentives in place to help people with disabilities go back to work. As of June 2016, there are more than 10 million disabled workers and dependents receiving a portion of more than $11 billion that is sent each month in Social Security disability payments. It can happen to anyone. Studies show that a 20-year-old worker has a 1 in 4 chance of becoming disabled before reaching their full retirement age. To meet the challenges of providing benefits to so many, the agency has evolved, using technology to operate more efficiently. Access to online applications for disability benefits, reconsiderations, and hearings have given applicants more service options when applying for benefits. Our Health IT initiative allows Social Security to access electronic medical records, including those from the U.S. Department of Defense, which reduces administrative costs, streamlines operations, and speeds up service to veterans. Social Security is committed to securing today and tomorrow for our millions of disabled workers. For more information about our disability program, visit www.socialsecurity.gov/disability SSI. Hello, I'm Andrew Salata. I'm a public affairs specialist for the Social Security Administration. I get the opportunity to reach out to communities to inform individuals about our Social Security benefits and let individuals know what is needed to either get a replacement card or even apply for benefits online. So we will cover any type of topic you'd like today. Although we have some questions about disability just to interest you, we'll talk about Social Security in general. And with me, my guest today is Dejanette.
Hi, Andy. Thanks for having me today. Just to tell you a little bit about what I do at Social Security, I actually help people who want to make a disability application because they can no longer work because they're disabled. So my job at the agency is to basically help people complete their application, identify their medical sources, and give them a real good idea of how long it's going to take to get a decision from us.
Hey, so we have an expert from our local Social Security offices, so we'll be able to help you with many things. So to get started, I guess let's talk a little bit about Social Security, or at least disability benefits. Where does someone start?
Well, the easiest thing to do is actually to go online and look at our Disability Starter Kit. You can find us online at www.socialsecurity.gov/disability_starter_kits.htm. You can request a copy of this by calling our 1-800 number at 1-800-772-1213. And of course, the TTY number is 1-800-325-0778. The Disability Starter Kit will help you prepare for your application and your interview. And when you're ready, you can actually go right online and apply at www.socialsecurity.gov/apply for disability. Or make an appointment to apply in person at any local Social Security office. And remember, our online disability application is convenient and secure. So please don't stand in line. Go online at www.socialsecurity.gov.
Yeah, I know it's a little bit daunting sometimes when people think about filing for Social Security disability or disability benefits online, but I always think or mention to individuals it's usually when you're thinking about disability or if you've gone through the process A lot of your records are at home, whether it's on your calendar for the doctors or the hospital visits. And when you visit us in the Social Security office, you may not bring or remember to bring all the information with you. So by doing the process at home or starting the process at home, you have more of a chance to make sure you've included all the information, because all that information is pretty important.
Absolutely. The more medical information you have, your names of your doctors, the clinics that you've gone to, even important names of family members and friends who may be familiar with your condition, all that is important to submitting a complete application for disability.
I guess when we think about talking about disability, right now we're kind of talking about disability in general, but as we get through the process, we'll kind of talk about two different disability programs. There's the Social Security disability, and then there's the Supplemental Security Income, SSI program. I'll talk a little bit about the disability program, what the guidelines are for that. Then I'm going to turn over a little bit for the SSI for you.
Okay.
So the Social Security disability benefits are basically an insurance policy. If you want to look at it, it's tied into your Social Security taxes do you pay at work, or if you're self-employed, the self-employment Social Security taxes you may do on your Schedule C and Schedule SE. To receive Social Security benefits, you'll need to have a certain amount of time at work to meet our criteria. For retirement, it's pretty easy, it's 40 credits. For disability, it's a little different. We're going to have to look at, if you're older than 31, you're going to need to have at least 5 out of the 10 years of work, or at least 20 credits earned in that 10-year span, because you can earn up to 4 credits per year. If you're younger than 31, it makes it a little easier. For example, someone who is 24 would only need about a year and a half's worth of work in the last 3 years, or since age 21, would need to have earned about 6 credits or a year and a half of work. So it's based on your work and paying into Social Security. And that's where, as the beginning part talked about, our 60th anniversary of disability, that's also where it's a program for dependents, where spouses or children are eligible to receive benefits. Before we talk about the SSI portion, let's take a quick caller. Hello, caller, you're on the air.
Yeah, I told you, screener. I would like to know how they justify judging it's going to be 0.2% this year, which is $2 on $1,000, okay, if that's what you get. And it's supposed to be from July 1st through the end of September, how they knew before that, and how, in God's name, could somebody see in a crystal ball when Obama got in office, no raises for 2 years. He hasn't even put when the last president Bush was in office, he had 5.6 or 5.8% per year. I just want to know the answer to these things. Okay.
All right. Well, I'll be happy to talk a little bit about our cost of living adjustment. First of all, the cost of living adjustment is not controlled in any way by a president. It is actually what Congress has set in 1975. So the cost of living adjustment was set in 1975 to look at the Bureau of Labor Statistics Consumer Price Index for a basket of goods, which is done for the third quarter of every year, as you mentioned, from July through September. What you're probably alluding to on the earlier part of your call about the 0.2% is what's been in a couple of articles that have been in the paper over the last couple of days. Actually, the Bureau of Labor Statistics hasn't released the complete numbers yet, so we have not provided the formula or reviewed the formula to get a cost of living announcement. So those are just speculation, and actually you were using the lower end of the estimate. The estimate is anywhere between 0.2 to about 0.5%. Still not a high amount, but it is based on that. We'll know more once the statistics have been reviewed. But again, keep in mind, this is based on Congress's review of what it is. When you were alluding to the 5.9% that was given back several years ago, That was based on a higher cost of goods, and what resulted in that is because of that spike in goods for that year, the following 2 years didn't have any cost of living adjustments because prices dropped back. To look at it over the long term, though, since 1975, when it was put into law, there's only been 3 years that have not had a cost of living adjustment. So Social Security, in its best process, provides a cost of living adjustment to keep your benefit intact with the rise in inflation. It may not always seem to work because based on expenses you may have, but Social Security does have that in place, and it's based on Congress's laws that are set. So before we take our next caller, I just wanted to get back to the SSI side for you.
Oh, yes, yes. The Supplemental Security Income is a disability program that's people that are either children or adults that have not worked significantly and paid into the system are eligible for to see if they're actually medically disabled. And so that program doesn't actually require work, doesn't require years of work. It doesn't require that. So it's a program that's eligible as a supplemental insurance program for pretty much everyone, regardless of whether you've worked a significant amount of years or not.
Yeah, it is more for children. It's pretty important because when we talk about the Social Security part of it, it's like you needed that work or you needed to have that Social Security tax. What happens when we do have a special needs child?
Right.
So that's where SSI can really come into play. And it is income based, but if we think about it, if a parent, if there's a family with a special needs child, there's a good chance that both parents in the household may not be able to work because the needs of the child need to be met, so the special care, so we'll reduce the income, and that's where supplemental security income can be that safety net.
Exactly.
So as we head back to our questions, before we do that, we do have, I guess, a caller waiting on. Okay, so maybe we hopefully had answered their questions. But so, you talked briefly about the disability part and how it covers children to adults. So with Social Security disability, children may not qualify on their own because they don't have the work experience, but they may qualify as a disabled adult child on a parent's record. Once a parent starts receiving disability benefits, is retired, or may pass away, a special needs child that's over the age of 18 may qualify as an adult disabled child or can continue to receive disability benefits as dependent benefits.
Exactly.
With SSI, though, I guess since it's income-based or resource-based, where do we really look at how the qualifications go for SSI for children that may be disabled?
Well, the qualifications are basically based on the parent's income or whatever parent is in the household with the child. And like you mentioned earlier, what happens is we do kind of examine the income, the resources, the things, bank accounts and such that the parent has available. But a lot of times because of the need of the special child, what happens is the income may be reduced and the parent isn't able to work sufficiently. So the supplemental SSI security program does provide a payment so that the parents can actually help as far as SSI disability. Okay, so Social Security is really responsible for running two major programs that provide benefits based on disability. The first one is the one that Andy mentioned to us, which is Social Security Disability Insurance, which is based on all your prior earnings. SSDI is actually financed through your taxes and paid into through the Social Security program. To be eligible for SSDI, the worker must make sufficient earnings, as he mentioned. But the SSI program that I'm speaking about is based on the financial need of the adult or the children who are either disabled or blind and have very limited income and resources. And also they must meet the living arrangement requirements to make sure they're eligible. SSI is a program that's actually financed through general revenue sources. And for more information, please go to www.socialsecurity.gov.
One of the things that I always hear about with Social Security benefits, with Social Security disability, is the changes when someone receives disability benefits. Once they reach retirement age, the question is, do they start getting retirement benefits? Do their benefits change? And for an important part for Social Security disability is since Social Security disability is kind of like your retirement benefit early because of a medical or an impairment that keeps you from working, so your disability doesn't change. I know with SSI has the disability program and also has an SSI program for aged individuals who are 65 and older. There is no difference in the payment rates for those, is that correct?
No, actually the payment rate is actually the same for the child, the adult, and then the aged person, or what I actually call like a senior citizen benefit. So that payment currently, can we see what that is?
Oh, yeah, $733?
Yeah. That payment currently is $733, and just as you mentioned earlier with the COLA, we're hoping that will increase for 2017. But that's payment is in place currently, like we said, just to help meet the needs of that disabled person.
I know I'm going to go off script for a little bit, but I always do that to my guests because, when I bring an expert from the office, it's just like they're answering questions instead of to someone in the window when you visit our office. It's just to everyone in TV land. But I know a lot of times, as in public affairs, when I do talks for groups, when I'm at like a senior housing event, or even if I'm at assisted living center for either special needs children or for adults, a lot of times the question comes up, well, I hear SSI is $733, but I'm only getting like a portion or 2/3 of that or something like that. Is there any reason, is there like a different pay scale?
No, actually there's not. What we do with SSI is we actually do count any other income into the household. So if you're working a part-time job or your spouse is working a job, those things are actually all factored in and considered as far as having a lower rate. And also, most importantly, I don't know how to forget this one, is whether you're paying rent or not, where you're at. So those things actually will actually reduce your check or, kind of influence the amount that you're actually able to receive.
Yeah, and I know, and I think that's something very important when we think about our transitioning youth. When we may have a special needs child in a household now, that based on the parent's income or resources in the household, the special needs child under the age of 18 may not have qualified, but now that child is getting older, say age 18, there might be some changes. And why would that age 18 be a big difference?
Well, age 18, at that point, we're actually just counting your own household. So when you're an adult at age 18, we just count your own household. We no longer count the income of your parents or the parent that's living with you. So that gives you an opportunity to, again, meet your needs because you're not able to work.
Okay, and I think that's kind of an important distinction to remember, because I know you talked about rents, so I can think of some of our viewers thinking, well, do I have to charge my 5-year-old rent now? But not at 5, but at 18, there might be a difference, because then as an adult looking at that household, they'll have to do some contributions to the household then?
Absolutely, yeah.
So before we go on to some other questions, I do want to just remind everyone that please give us a call at 312-738-1060. Even though we're talking about Social Security Disability or SSI, if you do have a question that you'd like addressed or need a little bit of guidance, we'll be happy to be here for you. Also, if you are interested in receiving any type of Social Security benefits, there's a couple of things you can do. If you have filed or you're planning on filing, you can file for most Social Security benefits at our website at socialsecurity.gov. However, if you are inclined for our traditional services and you may want an appointment to file for benefits, you can always call our 800 number at 1-800-772-1213 to schedule an appointment. And the great thing about it is, as you can see, our 800 number is open till 7 p.m. so you don't have to worry about calling now. You can wait and finish the show with us and then give a call afterwards. So that way you may not miss any important information. But that's just something to think about. As we start wrapping up the show, I wanted to talk a little bit about getting a letter from Social Security saying we want to review your case. It's not so much that we think we're going to stop your benefits, because a lot of people are afraid to complete the paperwork or afraid of what to do because they have this letter thinking we may stop their Social Security benefits for disability or SSI benefits. And really what we do is we do periodic reviews. We have to make sure your condition may have not improved, or with supplemental security income, there's those non-disability criteria that needs to be met. So, if someone's receiving disability, how often may their case be reviewed?
Normally, that time period is every 3 years, if I remember correctly. But the most important thing from the standpoint of Social Security is when you get a letter, come in, call, do something. Don't just sit on the letter. That's kind of one of the most important things. Even if you don't understand the letter, use our 800 number, have the letter in front of you, and let's read it together. So that way you can get a good understanding.
Yeah, because we do look at sometimes if it's a condition that's may be possible improvement later, or if you're able to maybe get some job training, we may review your case. If you have a permanent disability or disability from birth, it may be every 7 years. So
right.
It's not something we do often, but it's something we want to make sure we're doing correctly. So as we wrap up the show, we got one more caller on the air, so let's take one more call. Hello, caller.
Hello, yes. Hello?
Hello.
Yes. I'm still here.
Okay. What is your question?
Yeah, I want to know, in Illinois, how old you have to be have your Social Security, How old you have to be? Is it 65 or 67?
Okay. How old do you have to be to receive Social Security benefits?
Yeah.
Okay, well, I know you mentioned how old you have to be in Illinois, and it really is the same wherever. With Social Security, since we're a federal program, we have the guidelines throughout. So to receive Social Security retirement, you have to be as young as age 62. So the earliest you can receive retirement benefits is at 62. If you're disabled, though, you may receive it at an earlier age. If you are a surviving spouse, if your spouse had passed away, you may be eligible for survivor benefits as early as age 60, or at any age if you have a child in your care under the age of 16. With SSI, the only real requirements are if you're under age 65, you have to be blind or disabled,
Yes.
and then at 65, it's the senior benefit. So the best thing you can probably do is take a look at socialsecurity.gov for our benefits, or give us a call at our 1-800 number. And then that way you can take a look to see if you qualify or find out what benefits you may qualify. When you visit socialsecurity.gov, you can use our benefit eligibility screening tool, BEST, as it's called, to find out what you qualify for. So I thank you. And before we wrap up, I do always like to share some information about Social Security. So let's look at a little video.
Sweetheart, to help secure your new life together. We are there if the unexpected happens, to help you see life from a new perspective. We are there when you become a full-time grandparent or the author of your next chapter, to make sure you get off to a great start. And we are there when you lose your soulmate, to help make sure that you will be all right. We are with you through life's journey. We are Social Security, securing today and tomorrow. This video produced in U.S. taxpayer cents.
So I like that video because it kind of wraps up a lot of what we've talked about. When we talked about Social Security, even though we started the program talking about disability, as you can see, it could be there for any avenue of life, whether it's survivor benefits, if you are a young surviving parent and you have young children, you can be receiving survivor benefits for those children until they reach 18 or graduate high school. So with that, keep in mind, Social Security can be there to help you, and we thank you for your time And remember to see us next week as we talk about more Social Security. Have a good day.